Hello and welcome to HIV Talk Show. We're in lovely Savannah, Georgia today, and I'm so excited to be with my two guests today. We have Twala Marshall from the GCPG, which is the Georgia Community Planning Group. And we also have our guest Mark Douglas, who's been on the show before, from My Brother's Home, and you are the rural co-chair for the GCPG. So Twala, can you tell the viewers at home, what is the GCPG?
The Georgia Community Planning Group is a community-led advisory board that collaborates with the State Health Department to help prioritize and improve the effectiveness of the state's HIV prevention activities and funding allocations. Each state's health department that receives federal funding for HIV prevention activities is required or mandated as a prerequisite of using the federal funds to have an advisory board that incorporates community input and feedback into which communities should be prioritized in terms of HIV prevention funding and activities. So basically, the community planning process is intended to enhance the State Health Department's HIV prevention efforts.
So Mark, you're known for My Brother's Home. But how did you get involved with the GCPG and how did you become the rural chair? Can you tell us a little bit about your role?
As the rural chair, my job is to represent all those the agencies or the organizations outside the Atlanta metropolitan area. It's voted upon by my peers, by the members of the body of the Georgia CPG. And I've been involved in the Georgia Community Planning Group for 8-9 years now, primarily with the exception of last year as the rural co-chair. So again, it is my role to represent, to be the voice, one of the voices of those members, those organizations, those persons who have been affected or infected by HIV/AIDS in the great state of Georgia, to ensure that we have a voice in the continuous community planning process, as required, as Twala said, as mandated by the federal government, to involve or to have community input. Because the whole premise was to involve those populations which are or has been most affected by HIV/AIDS.
So how many times a year do y'all meet?
We meet 4 times a year. The objectives for this meeting are to vote on updating we operate under a 5-year comprehensive HIV prevention plan. This plan, this 5-year plan spans from 2009 to 2013. So this is the first year of implementing the 5-year plan. So during this meeting, what community members will have an opportunity to do is to hear updates related to the epi data that gives us some information about what the epidemic looks like locally based on data through December 2007. We'll also have an opportunity to hear some updates related to community service assessments, which is something that our group actively participates in. And the community service assessment entails doing a resource inventory, taking a look at the state and overall what HIV prevention and care services are available through the state, and interviewing consumers, those folks who access the services or would access the services if they were available, to see where the gaps are in terms of services. So that's one of the updates that the group will hear, CSA, as well as we've said data, we've said community service assessment, and we'll also be taking a look at some Ryan White care updates related to how many people Ryan White funding is serving, because our prioritized population, which is by CDC mandated, are HIV positive persons. So we will take all of this information and then as a group decide if the 5-year prevention plan that we established in 2008 is still relevant, or do we feel like the plan needs to be updated, and that will be one of the votes that we will vote on, and then take the new plan or the existing plan and operate through next year.
So this is a really great group because it gives people a chance to give their voice to where funding should be, where resources should be,
right,
and really engage and be part of a process versus being on the outside. You're actually part of the group and part of the inside.
Exactly.
And that's a wonderful thing. Now, do you find that it's hard to get people from the rural parts of Georgia to participate?
That's our greatest challenge as a rural co-chair, and has been for my years since I've been involved, is that we have the harder challenges in getting like youth involved, faith-based involved, transgender involvement and participation. and those persons who do live in outside the Atlanta area. That has been our challenge. So we're looking at ways to recruit and identify persons throughout the state, North Georgia, Albany area, Macon, Augusta, Dublin, Soperton, Columbus, Wake, all over. We're just trying to identify more people from rural, outside the EMA area to be involved in this process.
Well, Mark, what do you think? What do you think that is? Why is it harder to recruit in the rural areas versus the center of Atlanta, for example?
It has a lot to do just timing. I mean, you have to commit time. You have to have, be able to have the time, the flexibility, the resources to be able to meet, to come together, to be able to travel to Atlanta, to come to Augusta, to come to Macon, or wherever we do meet. Because you have to have some resources up front in order to be able to participate, in the time especially. But there's such a stigma involved still after 30 years, almost 30 years, Alton, that we're still confronted with in 2009. The fears, the homophobia, and it's just those are some of the few barriers that we have. But we've got to do more, and we're trying our hardest around it as part of the executive leadership here to identify and recruit more from other throughout the state. We
appreciate the double load that you're carrying from My Brother's Home to the GCPG, and you're just doing a wonderful job, and I wish you so much success continued in your organization, My Brother's Home, and through the GCPG.
I do want to say this. I want to make sure that the members that are listening to this broadcast is to please contact Twala Marsha or myself to get an application to join this body, because we're always seeking new membership, and the membership is constantly changing. So please contact Ms. Marsha or myself locally here in Savannah through the organization to become a part, if you live here in Georgia, to represent, because we always want people at the table. And if you're not a voting member, you still can come and observe and participate through our subcommittees. So we want to make sure that you understand that and get involved. We need you.
And it's a great working group. I mean, I've gotten to sit on one of your meetings, and I was overwhelmed by just the knowledge and the passion and the commitment that so many people in the room had. It was just absolutely wonderful. So it's a great organization.